It's the real news. I'm Aaron Mate. When he visited Puerto Rico in October, President Trump lauded what he called the low death toll from Hurricane Maria.
Every death is a horror, but if you look at a real catastrophe like Katrina, and you look at the tremendous hundreds and hundreds and hundreds of people that died, and you look at what happened here with really a storm that was just totally overpowering. Nobody's ever seen anything like this. What is your death count as of this moment? 17?
16 certified.
16 people certified. 16 people versus in the thousands. You can be very proud of all of your people, all of our people working together. 16 versus literally thousands of people.
But for months, Puerto Rico residents and experts have warned that the death toll has been vastly undercounted. And a new study confirms their fears. A team of researchers estimates that at least 4,645 people have died as a result of Hurricane Maria. About 1/3 of the deaths were caused by delayed or inaccessible medical treatment. Omaya Sosa is co-founder of Puerto Rico's Center for Investigative Journalism. In September, just days after Hurricane Maria hit, she broke the story that the government's official death toll was far too low. Omaya, welcome. Talk to us about the reporting you've done from the days after Hurricane Maria, what you found and how it tracks with what has just come out in this new study today.
Thanks for having me, Aaron. We started reporting on this story literally a couple of days after the hurricane. We heard what the government was putting out and what we saw on the streets and from regular people, policemen, rescuers, people at the hospitals, doctors, was very different from what the government was saying. So already from September 28th, we published our first story saying that we already knew it was dozens more than what the government was saying. And we have continued investigating since in December, early December, we already said that those first 40 days, the death toll was around 1,000 in excess compared to 2016. That was already based on official mortality data, only covering the month of October and the first 10 days after the hurricane in September. So this report basically confirms what we were already reporting in September, October, and November, and finally in that first week of December, that the death toll was much higher, that many of the deaths happened after the hurricane because of the inadequate response and because of problems with the healthcare system in Puerto Rico, which is really a pity, because when President Trump got here and made those unfortunate comments, a lot could have been done to prevent thousands of these deaths. So the data that Harvard puts out today is consistent with what we had been reporting and with what we have been investigating. We are still in the middle of a second phase of our investigation, and we're actually concentrating in the healthcare system and what happened there. And we are seeing that the deaths that were linked to problems with services, healthcare services, are probably even higher than what Harvard is saying today.
So when you say there that more could have been done to prevent these deaths, even after President Trump spoke, what are you referring to? Are you referring to the health facilities in particular?
There was no plan from our government and our health department to really get to know what was happening on the ground in the healthcare facilities. And when I say healthcare facilities, I refer to all the levels in healthcare: hospitals, elderly homes, maybe a smaller doctors and specialist offices, and so forth. It was a disaster. It was a complete disaster, and all the patients that needed life-saving services, or that were even stable but needed some kind of support, like for example, people that depend on oxygen, or people that need dialysis. those persons were really left stranded with no support system, and many of those people died. The government could have put in a response plan, an emergency response plan in terms of public health to canalize, to first know what was going on, and then try to canalize these patients to where the best facilities were or support certain facilities. But there was no organization of any kind. There was no information for patients to know where there were hospitals that were actually working. It was a complete mess. So
You mentioned oxygen.
I'm sorry.
Sorry to interrupt, but you mentioned oxygen. If I have it right from your reporting, the lack of available oxygen is due in large part to the fact that delivery of oxygen is privatized. Do I have that right?
Yes, it's privatized, and the roads were many roads were not. You couldn't drive through them after the hurricane. In the aftermath, the electricity was down everywhere basically. So these companies were not working. There are not many of them, and they were not working. So the whole system of delivery of oxygen and supplies and medicines, it wasn't only oxygen, it was all kind of supplies, was stalled, and there was no effective way for facilities to get these life supporting services, medication, insulin for diabetics, for example, and the government didn't do much to try and fix this.
What do you think accounts for the vast discrepancy between the official death toll? We heard President Trump back in October say it was 16. Later on, the government of Puerto Rico increased that to 64. But now the study says it's over 4,600. What accounts for the discrepancy?
I think there was a total lack of interest from our Puerto Rican government and from the federal government too, to really try and get to know what was going on. The resources were not assigned. From week number one, they already knew that people were dying at hospitals. I did a couple of interviews with the health secretary, our health secretary. A month after, I did an interview with the governor himself, and I told him we were seeing all this data and what was going on, and there was no interest in really assigning resources to know what was going on the ground, and that's what maybe they thought it would reflect badly on the image of how the response was coming along. I don't know, they never said.
All right, we'll pause there and come back in part two. My guest is Omaya Sosa, co-founder of Puerto Rico's Center for Investigative Journalism.